Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 26, 2025. This video is on a JAMA review published on September 15, 2025, titled New Molecules and Indications for GLP-1 Medications. What defines a GLP-1 medicine? A GLP-1 medicine exerts its effects at least in part via the glucagon-like peptide 1 receptor to stimulate insulin secretion, reduce glucagon, slow gastric emptying, and promote weight loss. How do newer agents like Tirzepatide and Retatrutide improve outcomes? Both Tirzepatide and Retatrutide are multi-receptor agonists that target GLP-1, GIP, and glucagon receptors, leading to superior weight loss and metabolic control compared to Semaglutide. What are the benefits of oral GLP-1 medications? Oral GLP-1 agents such as orforglipron offer non-injectable options that improve adherence, eliminate the need for cold storage, and may reduce manufacturing costs. Are GLP-1 medicines effective beyond obesity and diabetes? Yes. Ongoing trials explore their utility in neurodegenerative diseases, substance use disorders, inflammatory diseases, and even cancer prevention. How is muscle mass preserved with GLP-1 therapies? Adjunctive therapies like myostatin inhibitors, example apitegromab, or activin blockers, example bimagrumab, preserve lean mass while maintaining fat loss, improving the quality of weight loss. What makes triple agonists like Retatrutide unique? They target GLP-1, GIP, and glucagon receptors simultaneously, enhancing weight loss, glycemic control, and potentially liver and heart outcomes, cardiovascular outcomes. What's the role of amylin analogs in new GLP-1 therapies? Amylin analogs enhance satiety and delay gastric emptying. When combined with the GLP-1 agonists, they lead to superior fat loss and better metabolic profiles. What is MariTide and how does it differ mechanistically? MariTide is a peptide antibody conjugate combining GLP-1 receptor agonism with GIP receptor antagonism, offering once monthly dosing with potentially metabolic advantages. What is CagriSema and how effective it is? CagriSema is a fixed dose combo of semaglutide and cagrilintide that showed up to 20.4% weight loss in people without diabetes and improved hemoglobin A1C in type 2 diabetics. How do fixed dose GLP-1 and insulin combinations work? Formulations like IcoSema offer simplified once weekly dosing that improves glucose control, lowers insulin needs, and reduces hypoglycemia risk. Why are oral GLP-1 agents critical for global access? Oral agents reduce cold chain dependency and simplify administration, particularly valuable in low resource or high volume settings. What evidence supports GLP-1 use in Alzheimer's disease? EVOKE and EVOKE Plus trials are assessing oral semaglutide's ability to slow cognitive decline in early Alzheimer's, with results expected this year in 2025. Can GLP-1 medicines help with substance abuse? Trials show they reduce alcohol craving, self-administration, and cigarette use, with hazard ratios superior to approved therapies for alcohol use disorder. What do you know about muscle quality during weight loss? GLP-1 agents improve muscle quality by reducing fat infiltration, even as they reduce volume, especially relevant for older or frail individuals. What is the significance of weight loss independent benefits? GLP-1 agents may reduce inflammation and improve cardiovascular, liver, and brain outcomes independent of weight or glucose changes. What are the dropout rates for GLP-1 agents in the real world use? Persistence remains a challenge. Up to 65% of the patients without diabetes stop therapy within 12 months, highlighting the need for better adherence strategies. What future directions are being explored? Trials now target neuropsychiatric conditions, inflammatory bowel diseases, and even type 1 diabetes expanding the therapeutic reach of GLP-1s. Are GLP-1 agents being studied in cancer prevention? Yes, particularly in obesity-associated cancers via mechanisms including weight loss, reduced inflammation, and decreased organ cell mass. How does semaglutide compare with tirzepatide? Tirzepatide shows greater efficacy in weight and glycemic outcomes, but semaglutide has the most extensive outcome trial validation. What is orforglipron and why is it important? Orforglipron is a small molecule oral GLP-1 agonist showing promising hemoglobin A1C and weight loss results in early trials and shows easier manufacturing. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom.